Myself, Dr. Seran Reddy. I'm the Academic Director and CEO of ADrPlexus. Today, we are here to discuss about Combined Medical Services, UPSC Combined Medical Services Examination. We'll have a quick glance of what is this UPSC CMS examination and how the syllabus has been strategized, and what is the sure success module, like how you can crack this examination in the next 84 days, which are available for you. So the date of examination is 16th of July, and the last date of receipt of application is 9th of May. And how to apply? Basically, you have a OTR platform, like one-time registration platform, and the last, after creating the last date to modification of this OTR is on 16th of May, and then online application you have to do through UPSC online. It's simple. We'll generate one more video on how to apply. And there are like various centers of examination, close to 41 centers across the country. And it has a total number of posts close to 1,261. And category 1, the medical officers grade in general duty medical officers, subcategory of central health service of up to 584 posts. And category 2, ADMOs, assistant divisional medical officer in railways, 300, general duty medical officer grade 2 in municipal corporation of Delhi, 376. They're close to 1,260 posts are there. Out of this 1,260, how people are applying and writing this examination? If you see, there is scattered information. If you just go and see like how many students applied for combined medical service examination, you can see there's more than 3 lakhs. But if you carefully go and search from the official website of UPSC and download their annual reports, you see this combined medical services. So on an average year, it's around close to 40,000. And this year we are assuming close to 60 to 70,000 people, because the timing of the examination is important. When you say last year, it was a mix-up of the dates of which are closer to the NEET and all. So this time, even the INSET examination will be over, and we're assuming close to 60 to 70,000 people at least will appear for this examination. And out of this, how many people will be called for interview? It is 1:3 ratio. It is when 1,260 posts are there, close to into 3 times. That is around close to 3,700 people will be called for interview out of the 70. So you are basically, for every post, like 1,260 people, 1,260 posts, and close to 70,000 people are competing for this. So 1:60 ratio is what approximately you are competing here. And here 83 days are there for you to go, and how you can strategize your preparation. We had gone through the previous year question paper. There's a very typical pattern in this UPSC CMS question papers. When we analyzed the 5 years, 2 papers, that is starting from 2018, if we carefully analyze, you know, these 2 papers, it has like paper 1 and paper 2, both has maximum marks of 250 and maximum questions are 120 each. Subject 1, in paper 1, you have general medicine, which includes dermatology and psychiatry, up to 96 questions. Pediatrics, 24 questions. And similarly, in paper 2, you have 40 questions each. This surgery, including orthopedics, trauma, ENT, ophthalmology, 40. Obstetrics and gynecology, including family planning, 40 questions. PSM, 40 questions. This is how it is strategized. But if you see this, the questions which are repeats or which are relevant are very, very, very important. We had carefully analyzed how we had gone through the notification which was given and how many questions have been given from each of the topics. And it is surprising to have followed so meticulously. This is one of the beauty of this examination. They followed very meticulously whatever has been given in the notification, which is close to that. We had taken an average of how many questions were asked from this. And if you see this, from the general medicine, 96, again, from the cardiology, respiratory diseases, gastrointestinal, genitourinary, neurology, hematology, and all. You see, from cardiology, on an average, cardiology and neurology, you are seeing 7 questions every year. And from respiratory diseases, pulmonology, gastroenterology, genitourinary diseases, hematology, endocrinology, metabolic disorders, 8 questions. Sorry, 6 questions each are there. And from infectious and communicable diseases, there are 8 questions. And if you see here, again, it has been split in such a way that one each question from virus, rickets, bacterial, spirochetal, protozoan, metazoan, fungus. And here, in the year 2018 and 2019, there are 2 questions from bacterial and 1 question used to be from virus. But from the last 3 years, you see, on an average, there are 2 to 3 questions from virus and 1 question from bacterial. That is how the questions are coming. And I'll show you questions, how updated, they are asking the questions. In 2021, there are 3 questions based on COVID, and there is 1 question based on fungal. So when there was increased incidence of COVID cases and fungal infections. So it's been very standardized papers. And if you see this, medicine is not just about cardiology, respiratory diseases, gastrointestinal, genitourinary, neurology, hematology, endocrine, metabolic disease. How many come in? If you count this actually, and this comes up to 18, 25, 32, 38, 44, 50, 58 questions. It's only 58 questions here. Where are the rest of the questions? From the general medicine, we covered cardiology, respiratory diseases, gastrointestinal, genitourinary, neurology, hematology, endocrinology, metabolic disorders, infectious communicable diseases. Even if you combinedly do all these things, you are getting only 58 questions. Then where are the rest of the 38 questions? See here. You are getting 2 questions from the nutrition and growth, and diseases of skin, that is dermatology, you are getting 4 questions. Musculoskeletal system, 2 questions. From psychiatry, 4 questions. Here they are given a split. In psychiatry, particularly, 1 question each is coming from depression, psychosis, anxiety disorders, and like bipolar disorders and schizophrenia. So this, you can see this from psychiatry and dermatology, 4 questions each are coming. Musculoskeletal 2, and general probably touching about superficially too. And emergency medicine, they are asking 6 questions. Very important. Emergency medicine, and again poisonings, common poisonings, because common poisonings there are 4 questions, and there is invariably there is like 1 question from snake bite is there in every examination, and tropical medicine 3 questions, critical care medicine there are 4 questions. So emergency medicine and critical care combined takes up 10 questions, and emphasizing on medical procedures like subclavian, and how when you do the IJV cannulation, like what is the most common structures about all these things. Emphasis on medical procedures. Pathophysiological base of disease, only 1 question is coming. And vaccines, preventable diseases and non-vaccine preventable diseases, like 2 questions. And vitamin deficiency diseases too. Like just by reading that 1 table from biochem, like what are all the vitamins and the deficiency disorders, on an average of 1 to 2 questions are coming. So this is very important. So 38 questions are there here when you see the nutrition, growth, dermatology, psychiatry, musculoskeletal system, emergency medicine, critical care, common poisonings, tropical medicine, emphasis on medical procedures, pathophysiological base of diseases, vitamin deficiency diseases, and all. This is very, very, very important. And sometimes, if you see this 58, sometimes had gone up to 58 to 66, and this came up to 30 to 38. But on an average, for you, for easier understanding how we classified based on the last 5 years, it is 58 to 60 here and 30 to 38 here as coming. Then coming to pediatrics. Pediatrics also, so out of the 24 questions, from the common childhood emergencies, they are asking 4 questions, basic newborn care 4, milestones 4 questions, accidents and poisonings in children 4, birth defects and counselings including autism 2 questions, immunization 4 questions are coming from immunization related to that, and recognizing children with special needs and assessment 2, and national programs related to child health is 2. So pediatrics, no need to go in depth and read about this, specifically focusing on the milestones, poisonings, and all these things will help you out. Then coming to general surgery. See, general surgery is 40, but this 40 is not exclusively for the general surgery. It includes ENT, it includes ortho, it includes trauma, it includes ophthalm. Okay, and also include a question on anesthesia. So overall, if you see this, out of this 40 questions, 5 to 7 questions are coming up from alimentary tract, like esophagus, stomach, intestines, anus, and the rest of the questions, if you see, 1 each question is on an average is coming from wounds, infection, tumors, lymphatic blood vessels, cysts and sinuses. Invariably, 1 question is from breast and 1 question is from thyroid, like head and neck. And sometimes there is liver, bile, and pancreas. 1 to 2 questions are there. From 1 question from spleen, peritoneum, abdomen wall, and abdominal injuries. Sometimes they're mixing up in trauma. And here from urological surgery, 2 questions. That in this urological surgery, thrice the question has been asked, like in the 3 years, on the renal stones, basically once. And neurosurgery and ENT, there are close to 2 questions. Thoracic surgery, 2 questions. Orthopedic 2, opthal 2, anesthesia 2, and again trauma 2. And diagnosis and management of common surgical ailments. This you can even amalgamate in this alimentary tract questions also. And preoperative and postoperative care of surgical patients, and medical legal and ethical issues of surgery, wound healing, and fluid and lymphatic management. Invariably, one question each is there. So in surgery, not only the general surgery part, like you the maximum of 5 to 7 questions, and only one paper there were 8 questions in particularly related to the alimentary tract. Rest all you have to focus about on urological surgery, neurosurgery, ENT also where 2 questions are each is coming up. Then if you see obstetrics, gynecology, and contraceptives, obstetrics you are getting questions from 16 to 18, gynecology approximately 16 to 18, and from family planning you are getting 4 to 8 questions. In obstetrics, again very beautifully, 4 questions are close to an antenatal management, 4 questions related to intranatal, and 4 to 6 questions on postnatal, and management of normal labors or complicated labor, 2 to 4 questions are there. And even in gynecology and applied anatomy, there's 1 question, and applied physiology, there are 2 questions, and infections, neoplasms, or tumors, there is 2 questions each, and displacement of uterus 2. Normal delivery here, usually here, normal delivery and safe practices, usually we are including here, and abortions 2. Then coming to family planning, there are 4 to 8 questions here. Conventional contraceptives, intrauterine devices, oral pills, operative procedures, medical termination pregnancy. Invariably, 1 question is there from medical termination pregnancy. The least number of questions are like 4, and the maximum questions were asked was 8. Then, coming to preventive and social medicine, if you see, it has been very peculiarly, they have been categorized across, mostly predominantly they had given importance to health, demography and health statistics, 3 to 4 questions, communicable diseases and non-communicable diseases 4 each, and even national programs is which you can't ignore. So national programs, communicable diseases, non-communicable diseases, demography and health statistics, and this 4 and epidemiology, general epidemiology itself takes care about 45 to 50% of your entire PSM. So this is how it is. There is a minor variations, but overall, this is the things, period. And do you have a penalty for wrong answers? Yes, 1/3 is for wrong answer. The correct answer is you'll get for every question, like 1/3 of the marks. If you see 120 questions, and you are for every paper 120 questions and 250 are the maximum marks, it is approximately 2.08 is what you will get for every question. And similarly, 1/3 means it is approximately 0.67 is for the negative marking. And then you see what are the types of questions being asked. It is a single best option and also the multiple correct answers. The single best answer, if you see the ratio, if you just take an example of 2022 paper or 2021 paper, you can check it. Usually we assume that like 50-50 is ratio. Out of 120 questions, we assume like 60 questions will be from for single best answer and 60 questions are multiple options. But here, surprisingly, you can download all the papers and you can see it. So out of this, like single best answers are close to 50 to 55, and multiple option questions, they are going up to ranging from 65 to 62 to be specific, 62 to 68, and sometimes 70. So there are more of multiple option questions. So these are the multiple options, multiple correct options, like how you can identify. And so these are the various things. This is what like we had how you can easily eliminate the options, and the other options like how you can easily work. And this is a single best option where you are getting up to 50 to 55 questions out of 120. And if you see this is a 2021 paper. You can see a question on COVID, and based on 1 question on ICMR guidelines, and 1 question, even the statistics they had based on COVID, and again regarding 1 vaccine. In a single paper, there were 3 questions based on COVID. So this means like very updated, and the questions are being asked based on the relevance of the present day. So this is very, very, very important. So make sure like you are very well versed with this. And if you see this, after analyzing these question papers very carefully and seeing this single best answer, multiple choice question, multiple option, multiple answers analysis, and the number of repeats and the topic repeats are, if you see from 2018 to 2022, there were close to 55 to 60% based on similar topic repeats. When I said topic repeats, if there is a question on If I say in hematology, let's take an example, thalassemia. And in the thalassemia and sickle cell anemia, there's almost an invariably from both of this, like the question was there. So the topic repeats on, there's almost a question on placenta previa, almost there are like 4 papers. So that is how the questions have been designed. And so we peculiarly, after analyzing this, how best you can utilize this 84 days. Most important is getting an accurate answer and how easily you can eliminate the options. So we devised this question and with an appropriate explanation why every option is correct and why every option is wrong. In addition to this, the relevant content notes for every question, we developed this module. And as I said, as you know, this Target Show Success module, as we're launching on April 24th, and if you purchase before April 30th, you will get it at 899, and afterwards it's going to be 2,899. It includes 5 years paper with crisp explanation for all the questions, 1200 MCQs, and also set of 6 practice examinations, that is around 720 MCQs per practice. You have all these 2018 to 2022 questions uploaded in the app. And in addition to this, you have UPSC practice papers, almost like every 5 days, 7th, 14th, 21st, 28th, June 4th, June 11th, like 6 weeks, it will keep getting one mock examination, the practice papers. And now, what are the tips? What are the Shoe Success module? Very, 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 very important is going to the previous year question papers. Is very, very, very important. I'll explain more about this. Then try to make it as a digital detox for a better life. Like try to minimize the time you are spending on the social media and the internet, IPL and all. Try to decrease it and try to follow the Pomodoro technique. Plan your task like this particular 25 minutes sequence in 25 minutes and 5 minutes rest, or 50 minutes and 10 minutes break. So what we suggest is 25 minutes of focused reading and then take break for 5 minutes, complete 4 Pomodoros and then take a long break for half an hour and relax. Have a focused reading. It's not about multitasking. Have a focused reading. And then revision is very, very, very important. So what, as I said, like medicine is, if you don't revise, it's as good as not read. Whatever you read today, make sure that you are going to revise tomorrow. At least like 10 to 15% of your time for that particular day should be allotted for the revision. Very, very, very important. Spaced repetitive revision module, like which we are again going to give in the app, like how you can draft through it. Then previous year questions are very, 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 very important. And we are compiling the list of the most important repeated topics. Very, very, very important, which you can't afford to go to the examination. And by just going through these repeated topics, making sure that you know everything about these repeated topics will make you place you to get a single digit or double digit rank and to stand at the top in UPSC CMS. And this 5 mock examinations with an accurate and appropriate answers, mastering them and the relevant topics and the high yield topics is very, very, very important. And that's why we developed this module. And try to be the best version of yourself day on day, and every day keep improving yourself and what best you have done and how best you can improve tomorrow. That is what you focus on, compare. And as I said, like we are with you guys, and all the very best.